So a person that goes in, either they're wearing a denture or you had to do a full mouth of extractions and give them a new set of teeth supported by dental implants.
Yes.
What's that, the post-op, or what what can they expect?
Yes.
The downtime?
Usually they have a caretaker, because usually we would have them sedated, right? So somebody is going to watch them afterwards. They're going to come from the office. They're going to be very groggy, so they're going to want to sleep a lot. One of the things that I tell the caretaker is that it's really important that they don't fall asleep on their back with their chin tucked down, because what can happen is it can kind of just block off the airway. And so it's important that their caretaker kind of watches them, and if they're sleeping on their back, encourage them to sleep on their side, for example. We want to make sure that we control swelling. And for that, we give some meds in the office, but we also tell the patients what to take afterwards. These are prescription or non-prescription. Icing is really important. When you ice it down, you minimize swelling. And really, any sort of postoperative discomfort will mostly come from swelling. It's amazing how wounds in the mouth...
Is it the gums? It's mostly the gums that are sore?
Yeah, it's mostly the gums. And so the stitches are holding it together, but if you get swelling, it pulls on the stitches, and that's what hurts. So if we control the swelling, then we don't have to medicate as much. I find that we have to do... there's a big issue with narcotics. We have a big problem in our country with narcotics. So we're able to reduce the amount of narcotics we have to prescribe, because we're able, with over-the-counter pain pills, to really get them very comfortable and be well.
How soon can they go back to work, by the way? I mean, if everything works out right.
It really depends on the case. If you control swelling, I have patients going back to work a couple days later. It's really no big deal. If you have a job where you talk a lot, like, for example, for you, I would wait a little bit longer, because a lot of talking increases blood flow to the area, and again, that causes swelling. We're trying to counteract swelling. They're able to eat right away. They just should pick softer foods, easy to eat foods, applesauce, mashed potatoes, fish, scrambled eggs, that kind of stuff. And they want to minimize exercise in the beginning.
So how long do you want them to be on this soft diet?
Really depends on the case.
Like if it's a full mouth?
Full mouth. So if it's a full mouth reconstruction and the implants have to integrate, the first couple weeks is really important to have
just
a rather mushy diet, right? And then you gradually increase the firmness of the foods. And we'll give you, it also really depends on the case. I will give you further instructions. Hey, your implants were really stable. We can go back to this sooner. And in some, I might give you more restrictive instructions.